The biceps muscle is located in front of the upper arm. It is attached to the bones of the shoulder and elbow by tendons, which are strong cords of fibrous tissue that attach muscles to bones. Tears are most often caused by a sudden injury and tend to result in a greater arm weakness. So this strong tendon of the distal biceps can rupture with a very strong contraction of the biceps muscle. So after the injury, there is usually localized pain at the front of the elbow with bruising and swelling. The biceps muscle may retract up the upper arm, creating a prominent bump known as Popeye sign, which is actually created by the recoiled, shortened biceps muscle. And this is often visible different to the other biceps when contracting the muscle. Some patients feel a pop at the elbow and the tendon rupture. Other symptoms include weakness in bending the elbow, weakness in twisting the arm from palm down to palm up position, and in some patients we can feel a gap in the front of the elbow created by the absence of the tendon. In addition to the examination, your surgeon may recommend imaging tests to help confirm a diagnosis. Although X-rays cannot show soft tissue problems like the biceps tendon rupture, they can be useful in ruling out other problems that can cause elbow pain. Ultrasound can be helpful, although MRI scans remain the gold standard. These scans create better images of soft tissues, and we've published our results. They are the most sensitive and specific in demonstrating both partial and complete tears of the distal biceps tendon. So once torn, the biceps tendon at the elbow will not grow back to the bone and heal. Other arm muscles make it possible for you to bend the elbow fairly well without the biceps tendon, but the tendon itself, if it's completely ruptured, is unlikely to heal. Although other arm muscles can substitute for the injured tendon, and that can result in full motion and reasonable function, it's actually dependent on what type of sports you would like to do and your level of activity, because without surgical repair, the injured arm will have, according to evidence, around 50% reduction in forearm twisting strength, which we call supination power, the activity of moving the palm down into palm up, and also 36% reduction in elbow bending strength, which is we call the flexion power in sports medicine. A biceps tendon rupture leads to weakness of the elbow and the forearm. However, but non-surgical treatment options focus mainly on relieving pain and maintaining as much as arm function as possible. So it is actually like everything else with managing patients, not scans. So it is a mutual decision with some of my patients. So we would consider non-surgical treatment if in older patients, less active, or if the injury occurred in the non-dominant arm and the patient can tolerate not having full arm function. Having said that, the problem might be that this arm the patient might have cramping pain in the arm a few months down the line, and there might be associated weakness which might not be tolerable, and then the need for surgery at that time point might also be indicated. So surgery to reattach the tendon to the bone is necessary to regain full arm strength and function, especially that we see these type of injuries in active athletic patients in most of the time. Once torn, the biceps tendon will not grow back to the bone and heal. And if we're worried that they cannot fulfill the functions of they need to undertake, we would tend to reattach the tendon into the bone, and there are different surgical options to do so. Surgery to repair the tendon should be performed during the first 2 to 3 weeks after injury, ideally. However, it can be done in the first 6 weeks after injury. Because we're worried that the tendon and the biceps muscle begin to scar and shorten, and restoring arm function with surgery might not achieve excellent outcome as we would be aiming for. There are other options available for patients requiring late surgical treatment for this. However, they are somehow more complicated and might be a bit less successful. There are different procedures to reattach the distal biceps tendon to the forearm. Some would prefer using one incision, some would use 2 incisions to reattach the tendon. A common surgical option is to reattach the tendon through an endopattern or soft tissue or bony anchors and reattach it anatomically where it belongs. There are pros and cons to each approach. And obviously, when you're seeing your surgeon, you have to be sure to carefully discuss the options available with your doctors. There are complications associated, which you should discuss in detail. These include numbness, infection, and other complications. After surgery, it is crucial to undertake rehabilitation. Your doctor will soon begin having you to move your arm as soon as we can with some protection depending on the quality of the repair. Resistance exercises such as lightly contracting the biceps or using elastic bands will be added gradually to your rehabilitation plan. Since the biceps tendon takes up to 3 months to fully heal to achieve osseointegration, so bony healing between the tendon and the bone, it is crucial to be cautious in the first few months after surgery. However, we tend to mobilize the repaired tendon as soon as we can immediately after surgery. Of course, light work activities can begin soon after surgery, but heavy lifting, vigorous activity, weight lifting should be avoided initially and only dictated by your physiotherapist and your surgeon when to resume full activity. Although this might take longer than what you ideally need, it's crucial that your commitment to the rehabilitation plan is prioritized, because it is the most important factor in returning to all the activities you would like to enjoy.